Okay, let's see. Let's make sure. Yeah, it does work. Okay, well, good afternoon, everyone. My name is Abhinav Leonel. Oh, there you go. And in the next 45 minutes or so, we're going to explore one of, at least in my opinion, the most exciting frontiers in cancer wellness and cancer recovery. And that frontier is the human mind. Not to be confused with the brain, the organ inside our skull, but the mind, the non-physical part of ourselves, the thinking, feeling I that is somehow related, but also seemingly separated from the body. It is mostly, well, before we do that, I want to thank Anne Fonfa, where are you? Right there, for both having the vision to include this topic in this conference, so very important, as well as inviting me to speak about it. So thank you so much. The human mind is mostly missing from the discussion around cancer wellness and cancer recovery. It is likely that most of the literature that you will find in your doctor's office, even in this conference, mostly revolves around the physical body. Practices like acupuncture and massage and qigong and nutrition, they are all incredibly important. They empower us to take part in our own care, but they revolve around the physical body. In other words, they use the physical body as a vehicle for transformation. What about the other half of the mind-body equation? What about the mind? So this is it's a wonderful opportunity for me to bring this other equation and talk about the mind, and mainly hypnosis, which allow us, like no other method, technique, or tool out there, to engage that part of ourselves, and to do so in a way that is beneficial on every level, the physical, the mental, and the emotional. A good analogy for the mind is the car and the driver. You can have the best vehicle, the best body, the strongest body, the strongest vehicle, the most sophisticated vehicle. But if the driver is not properly trained, it is likely that he or she will not get the most out of that vehicle. And more to the point of our discussion, we want to ensure that the driver arrives safely at their destination. And in our case, it will be a state of wellness or a mindset of recovery. So let's start explore the human mind. This is interesting that it's behind me, but it's okay. The human mind, which I like to call the missing link. And we're going to talk about the human mind in the context of its relationship with the brain, the nervous system, and immune system. Because this relationship, which we often refer to kind of informally as the mind-body connection, this relationship is the foundation and the very reasoning for even thinking about integrating hypnosis into mainstream cancer care. It's the very reasoning, because it highlights both the mechanism through which the mind, the non-physical part of ourselves, can affect an organic disease like cancer in the body, as well as the method of how it can be done. And in fact, these two elements, the method and the mechanism, or I should say the lack of them, is the very reason why medicine has failed, at least so far, to include or integrate hypnosis in mainstream cancer care. And they didn't have, first they didn't have the rational explanation of how by working through the mind, which is non-physical, we can affect the physical body. And secondly, medicine was not aware of an effective enough method, such as hypnosis, to engage and work with the mental and psychological factors that influence or participate in influencing the internal environment within the physical body. The good news is that both these obstacles have been resolved, and we are now able to do those two things. How many of you have heard, by the way, of the term psychoneuroimmunology? Can you raise your hand, please? Okay, a good amount. Wonderful. So for those who have not heard or haven't explored the discoveries of psychoneuroimmunology, it's basically a young field of scientific study, only 40 years old. A scientific study that investigates the relationship between psychological processes and the nervous and immune system in the human body. It's only 40 years old, and for that matter, it is still surprising that not everybody knows about it, that this is not common knowledge. But basically, it is a science that kind of helps us understand the relationship between that which we hold in our mind and that which we hold in our body. And it's important because when patients feel helpless and hopeless, when patients feel disengaged because only that physical part of them is being cared for, this information is what they need to begin and move in the other direction. When you think about it, we have gotten very good, and by we I mean medicine, we've gotten very good at treating the physical body. But the truth of the matter is that that doesn't solve the problem. In fact, treating only the physical body does something very unique. It separates the cancer patient from the cancer, as if to say this illness has nothing to do with you. How many of you have felt that during treatment? As if you're laying there and you're not part of what's going on, what's taking place. Psychoneuroimmunology really provides us the very rational explanation of why we should also engage patient's mind, treat the whole person, not just their physical body. And in doing so, in treating the whole person, we are able to increase positive medical results. And the bottom line is we can save lives. And it's very true. The miracle of medicine has brought us a long way, and more lives are saved nowadays than ever before. In fact, I would say that in the hierarchy of treatment, medicine should come first and the mind should come second, but a very close second, because they are both very important to promote a state of wellness and a state of, or a mindset of recovery. So we're going to explore what psychoneuroimmunology really means without getting too deep into it. There's a lot of other more qualified people to kind of explain the finding of this scientific study, and I would leave that to them. That's a whole different presentation. But if we listen to what leaders in this scientific community say about the findings that they come up with, it's very inspiring. And leading researchers like Dr. Spiegel, or David Spiegel, who is a psychiatrist and a researcher at Stanford University, when we listen to what someone like him is saying about cancer in particular, we can begin to get a sense of why it is so important to engage the mind. David Spiegel said that stress, which that's what primarily psychoneuroimmunology is studying, the effect of stress on our body, he said that stress can adversely affect components of the immune system involved in fighting disease like cancer. And this is an important statement. It is important because of what it implies. It implies that if we can help patients address and resolve the root cause of their stress, of their mental distress, we can possibly ensure the proper functioning of their immune system. And we can even possibly enhance its ability to engage in the elimination of cancer cells. And this is very important, despite the tremendous technological advancement of medicine. Cancer, even nowadays, is still a challenge. The cancer treatment is still very much a challenge. So even if you hold the extreme insight that, well, the mind isn't really a part of that equation, and even if it is, it's just one tiny little percent. What if it is the tiny little 1%, the crucial percent, that can tip the scale from illness to health? Wouldn't you want to make sure that you left no stone unturned? I know that I would, and I believe that many of you would as well. So when we come to explore psychoneuroimmunology, we discover that it's based on some assumptions. First, that emotions play an important role in the development of physical disease. How many of you kind of get the sense that this statement is right? Okay. The second assumption is that different stressors produce different reactions in the body, and these reactions alter the state of homeostasis, which basically is state of balance, state of health. Does that resonate? Okay. The third one is interesting. The third one is that there is a bidirectional interaction between the neuroendocrine system and the immune system. Now, by the way, just as an aside, this presentation doesn't kind of highlight the references, the scientific references, but all of these statements are based on papers and research that was published. And if it is important for you, come see me after the presentation. I'll be sure to send you a copy of all these references. But I wanted to keep things simple and focus on the message of today. So when we talk about a bidirectional interaction, which next slide is kind of a busy slide, but I'm going to try to explain. Bidirectional interaction basically refer to the cases where two interactions are so closely associated that they can be treated as one interaction. Hence the mind-body relationship. Where does one begin and the other one end? And specifically, it refers to the ability of the brain to communicate with the immune system via the central nervous system, and in turn, have the immune system affect the body's resiliency, ability to cope and maintain its state of health. So this one stroke of biological process, we call it a mind-body connection, but it's really far more, much deeper than that. But kind of, we summed it up just to simplify things. Basically, we understand, and we have the science to prove that the brain, the mind, the brain, the nervous system, and immune system are connected. So working on one part of this integrated system will affect the rest of the system, and vice versa. The one part that I would like you to pay attention to is on the top section of that diagram, and that relates to the state of stress and depression, because these two aspects are not necessarily physical aspects as in biological aspects. They are mental aspects, and they equate to the experience of suffering, which is really what we are here to try and resolve, because we understand that what we hold in our mind certainly does affect the physical body, inhibit the capacity of the immune system to function properly. And that's what we want to try and avoid. This quote from Dr. Alistair Cunningham from the Ontario Cancer Institute says that suffering is a mental reaction to events perceived as unwanted. And much of the suffering that cancer causes come from reflecting on the diagnosis and what it implies, rather than directly from the disease itself. Do you kind of recognize that, agree with that statement? Okay. He goes further to say that cancer is thus an existential crisis, not simply a physical problem. Now, while your medical team is doing everything in their power with the tools that they have to mend and heal your physical body, it's really up to us to ensure that we do everything we can to minimize the mental, the suffering on a mental and emotional level. And let's see how it's done.